my beautiful friend, and welcome back to another episode of the Health Habits and Epic Living podcast. Today, I have a very esteemed guest with us that I'm super excited to have an amazing conversation with, and that is Dr. Marcia Harris. She graduated from Columbia University with her MD degree, specializes in OB-GYN. For the last 10 years, she's been practicing as the medical director of the Wellness Restoration Center in New York City. She's also involved in holistic and integrative medicine, getting to the root cause of diseases. And she's very passionate about menopause and empowering women, really in all walks of life, but really to take charge of their health and to treat women as a whole patient, which we will get into today's episode. Dr. Harris, welcome to the podcast.
Thank you. Thank you so much. Thanks for having me.
So we're so excited to have you on the show. And I know there's just so much out there, so much information out there about hormone replacement therapy and menopause. And this has really been highlighted, at least for me in the past year and in my zeitgeist as I'm navigating perimenopause and having to educate myself and knowing that Women's Health Initiative came out in 2002. And I think that's where I got stuck and I haven't been updating myself. So I'd love to get your perspective as an expert in this field is like, what are the misconceptions or misinformation that you're working with when you see women come in navigating perimenopause and menopause?
How much time do you have? Because it is absolutely amazing. I'm an old lady, kicking and screaming. And I trained back in the early 70s. And in the early 70s, they taught us about menopause. The shutdown didn't come until the turn of the century. And you know what happened there. I won't go into it fully, but the study that did this to us, and they actually owe us because there's a whole generation of women who have been shortchanged. An entire generation of women. We used to treat everybody, literally used to treat everybody. And then 1995, the head of the CDC, I don't remember her name, decided that the things that we were saying, hormones helped cardiovascular disease, hormones helped with bone, hormones helped with cognitive decline, hormones help with all the things we now know that it really does and that we thought it did. And she said, we have never proven it. Let's prove it. That's kind of how the Women's Health Initiative started. So it was with good intention, but it was so flawed that it ended up being more bad than good. And this is 23 years since it's been stopped, and it's still affecting the way women are treated right now. Basically, the Women's Health Initiative study was a multifaceted study which took women from 40 to 80, but their criteria was such that if a woman had any symptoms at all, she was not eligible to be in the study. Now tell me, so they literally, the average age of women in the study was 66. 66. Perimenopause starts as early as 39 or 40. So there's a whole 66, 15 or more years worth of women were locked out of because at that point, you are symptomatic. 8 out of 10 women have symptoms. There are 34 basic symptoms, 20 secondary symptoms, and at least maybe 60 tertiary symptoms, something where it's like, oh yeah, that could be because of menopause, or that might be, or what have you. Okay. But there are 34 basic symptoms.
Wow.
Night sweats, hot flashes, insomnia, all of those, anxiety, depression, thinning skin, thinning hair, cognitive memory loss, brain fog, you know, all of those symptoms are primary symptoms. And they start as early as 39 or 40. So when they cut out the fact that you couldn't have any symptoms and be in the study, they cut out a whole generation of women. All of those perimenopausal women were not allowed to be in the study. And that made a big difference. It was totally flawed. Totally, completely flawed. Now, take that aside, put on top of that the hormones that they were using was mainly horse's urine for the estradiol and stuff, and synthetic, mixed in a test tube for the progestin. And actually, there were 3 arms to the study, and the arm that had the most problem was the one with the synthetic progestin. You know, the estrogen arm of the study actually wasn't bad, even though they came out with, it increases the incidence of breast cancer. When you look at it, when they went back over the study and redid everything that was said initially, and they looked at the actual data, when they sat down and analyzed the actual data, it took the numbers from 4 in 1,000 to 5 in 1,000. You don't have to be a statistician to know that that is not significant. But the pharmacist, and I'm sorry, I know you're a pharmacist, the pharmacist who put it out there, normally when the study is published, it's completed, they put it together, the committee sits down, they go over the data, they put it together, they write it up, they figure out how and where they're going to publish it, what they're going to say, whatever. He got the information from somebody else. Oh, it looks like it increased breast cancer. Oh, I think it also increased dementia. Oh, we can't allow this to happen. And the pharmacist, without permission, without waiting, without going through the normal channels, he actually put it out there, picked up by the New York Times, picked up by the Wall Street Journal. I'll never forget that day. If my phone didn't ring 200 times that day, because I was already in practice. And when I said the phone rang off the hook, it rang off the hook. Everybody was called. Oh my God, the New York Times says I'm going to get breast cancer. Oh my, the Wall Street Journal says, and it was the headline. Hormones increase the risk of breast cancer. Okay, Wall Street Journal, New York Times, same thing, without the information. Now, that was quickly debunked. It was actually debunked within less than 2 years.
Mm-hmm.
They took the data apart, they put it back together, and when they did, all of that was wrong. It was completely flawed. But instead of being headlined this time, it was 2 paragraphs on page 30 on the bottom of the page. And there are still physicians out there who know nothing about menopause because the schools basically just stopped even teaching about menopause. The one lecture the doctors used to get, they didn't even get that anymore.
Such
so
a disservice.
There are a lot of doctors who know absolutely nothing. Gynecologists who know absolutely nothing about menopause. That whole 20, 25-year period, none of those physicians know anything about menopause.
Yeah. And like you said, just the amount of fear that study that was erroneously communicated, a lot of that fear still exists.
It still exists. I've had patients come in last week saying, my doctor says I cannot take that because I'm going to get cancer. I cannot take that because it's going to increase my risk of dementia. I cannot take that because it's going to increase my risk of blood clots. I mean, what's funny? All those same physicians write prescriptions for birth control pills every single day. And not only are birth control pills synthetic and horse's urine, etc., but there's 10 times more hormone in birth control pills than what I give with hormone replacement therapy. 10 times more. And they have no problem writing a prescription for birth control pill. But oh, no, 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 you can't take that. It's not good for you. Now, the question I always ask, here we have something which we as women have been dealing with basically since birth. I mean, we're born with 400 to 600,000 eggs. And, by the time we get to 40, there are not that many of them left. But we've been dealing with this from puberty to when we actually become perimenopausal and menopausal. We've been dealing with this. How could something which has been good for you for all this period of time and for most of your life, suddenly, when it goes away, you can't give it back because it's now bad for you?
I get your point. Right. We make these hormones, these natural bioidentical hormones.
Naturally?
Yes.
Not just that. There are 400 different functions. 400, because there are hormone receptors on every single cell in the body, every cell. Now, whether it's a thyroid hormone receptor or a cortisol receptor or androstenedione receptor, whatever, there are hormone receptors on every single cell in the body. So when we start losing our hormones, every single cell in the body is affected somehow, or at least ultimately. The other thing is, your great-great-great-grandmother and mine did not live past 50 because there were no antibiotics. So the slightest infection, and half of them didn't make it. A lot of women died in childbirth, whether them alone or them and the baby, etc. I mean, there were so many things which took us out. The average age of death for a woman was 54, 55. So by the time we got to the point where we had the problem, we were about to sayonara anyway. We were about to leave. Now, the average age of life for a woman is 86 years old, and for a man is 79 or 80. So we're living a third or more of our lives after menopause, a third or more. So you're going to tell me that I got to suffer that last third to half of my life? That makes absolutely no sense. Now, I'll tell you, I found this for me because I was non-functional. In my late 40s, when I started going through menopause, I literally was non-functional. Matter of fact, if you wanted to clear the halls, you wanted to clear the halls at New York Hospital, let me come off the elevator. The nurses would duck into rooms. The halls would clear, okay? And they would peek out. Let me see, is she screaming today? What does she have on? Is she wearing sneakers or is she wearing her 4-inch heels? Because if I was wearing my 4-inch heels, okay, they would come out. Good, she's in a good mood. If I was in sneakers or flat shoes, they would never come out of those rooms, okay? Because when I say I was non-functional, I was non-functional. There are the 20% of women, 15 to 20% of women who really have very minimal, if any, symptoms. 15 to 20% of women get everything. Then you've got the 60 to 70% in the middle.
Yep.
It varies. Okay. Well, guess what? I was in one of the 15% who got everything.
Mm-hmm.
I used to have 15, 20, sometimes 25 hot flashes a day. They would start, through my feet and come up through my body and go up. And I'd rip off the lab coats, and then I'd rip off the jacket, and I'd rip off the blouse. I mean, hot flashes to beat the band. Forget about night sweats. Forget about the mental. I mean, my son, I'll never forget, 5 years old. My daughter is 5 years older. My son was 4. My daughter was 9. They went for a walk with the housekeeper. He came back with a bunch of dandelions. Mommy, look what I brought for you. And I went, what do you want? And took his head off. His eyes bugged out, and he backed out of the room. He didn't even turn around until he got to the door. He got to the door, he turned around and ran. Okay. And my then husband looked at me and said, damn, why don't your period just come already? I can't take this anymore. And I said, right. Because up to that point, I didn't even think of it that I was PMSing, that I was perimenopause. It never occurred to me until he said that for 2 weeks, I was the nicest, sweetest person. And for 2 weeks, you couldn't come near me. Literally could not come near me. PMS, pretty mean sister. Man, forget it. Okay. So when I went through menopause, I found this for me because I was non-functional. My brain went to mush, and I had literally all 34 of the primary symptoms. And I mean severely. Okay. I found bioidentical hormones for me. All right. Didn't like the idea of the horse's urine. At that time, mostly what we were using was the conjugated equine estrogen, which is horse's urine. They didn't even try to hide it. Premarin, pregnant mare's urine. There are a lot of people even today taking Premarin who don't know that what they're popping every morning is horse's urine. Okay. So I actually found bioidentical hormones for me. And I started with yam cream, Mexican wild yam. Okay. And I'd get up every morning and rub it on and whatever. And for 2 months, it actually helped. And then I graduated and went up the line. I mean, because nothing lasted more than a couple of months,
Yeah.
I found hormones, and we're talking about 29 years ago.
Yeah.
I actually brought bioidentical hormones to New York City 29 years ago.
Yeah. And by you suffering and not wanting that for yourself, and being in practice, not wanting that for your patients, right? Now you're such an advocate because you realize the benefit it had to your body. Now we have the data now to support them.
We have the data to support it. At the A4M meeting 2 years ago, in A4M meeting in Las Vegas, the American Academy of Anti-Aging Medicine has this huge conference in Las Vegas every December. I have missed 2 of the 29. 2. One, because I had a death and had to go to the islands, and one during COVID, and they didn't have it. Literally, I have been there for 27 years. And when they put it on the calendar, they call me. I'm one of the people they call. Okay. We just scheduled it. Can we get your Amex, please? No problem. Here it is.
Speaking of, I was at the A4M meeting, not the big one in Vegas, but I went to one of their smaller ones in Miami 2 Januaries ago, and it was phenomenal. I learned so much about hormones, and the speakers were really great. And it was data just in the last 20 years is what they had to cover. And there was just so much to fill the 3-day symposium that I went to. And when I came back from that conference, I was like, I've got to educate others. And I started talking about it on my podcast, which is, I'm so thankful you're here to share your knowledge. But yes, getting this information out is so important.
Oh, it is.
So, Dr. Harris, what are some of the things you discuss with women now in this menopause phase, that phase that can last almost half of their life? What are some of the principles you want women to know to keep them empowered, to keep them vibrant and living long?
Right. Basically, I would like, and I do this with everyone because we have to advocate for ourselves. Women have to understand and realize that it's up to us. And we have got to take care of ourselves. We've got to advocate for ourselves. We've got to go in, having done our research, knowing what we want, and finding the practitioner who is going to work with you. Ladies, find the practitioner who is going to work with you. I had a woman come in a little bit over a year ago, and she was 44 years old. She had been suffering for 2 years, starting about 42, and she was suffering. She had literally every symptom in the books. And she had seen 4 or 5 different gynecologists, all of whom dismissed her. They told her, suck it up. It's just starting. Get accustomed to it. Suck it up. She waited 5 months to get an appointment with the head of the menopause clinic of one of the premier New York institutions. I'm not going to say which one, obviously. She waited 5 months to get that appointment. She went in, the woman did not examine her, did not test her, listened to her, and dismissed her, just as the other 5 gynecologists had done. And when she insisted, she gave her a prescription for Prozac, gabapentin, and Veoza, and said, see me in a year, okay?
That's horrible.
One of my patients, when she told her, she said, look, I've been telling you for almost 2 years, you got to go see my doctor. She came in, I worked her up, and as an aside, I do a full workup because whereas I know it's menopause, 98 times out of 100, I'm going to be right. But there were 2 times where I just might miss something. So I looked for Lyme, mold, inflammation, vitamin deficiency, all of the things that can play a part. Thyroid, everything else. I do a full workup. I did that. She was fine. It was indeed perimenopause. I put her on bioidentical hormones. She came back 6 weeks later and she blessed me. God bless you. God bless you. God bless you. God bless you. I am functional again. I feel like a person again. My husband's not going to leave me anymore. He's happy. I'm happy.
Yeah, that's so true. They can make a big difference in somebody's life for sure. And I do want to emphasize that point that you made is you have to be your own advocate. I talk about on my podcast in the past how many times I've been to a practitioner and we didn't see eye to eye, or my symptoms were dismissed, or I wasn't getting the care that I wanted to receive. Or so I think it's well stated that you may have to go through a few different people to find the person that you are going to resonate and is going to hear your symptoms and try these modalities that can help them so much.
Find someone who's going to work with you.
Absolutely. And I know you have quite a few resources, Dr. Harris. If you want to share that with my listeners, they would be happy, I'm sure, to get a hold of these resources.
Well, basically what I'll do, I'll have my manager send you the link, my ebook and my survival toolkit. And,
Yes.
what have you, so that they can actually go in there and get.
Yeah. So we'll definitely put a link in the show notes to your free ebook and your other resources that you're offering. And if women are in the New York area, where can they find you and learn more about you to work with you?
Oh, the website is, as I said, the Wellness Restoration Center, and drmarciaharris.com, 646-478-9833. I'm on Madison Avenue in New York City, the heart of the city. And right there, it's easy. And I have patients who fly in from Istanbul and Dubai and drive down from Vermont and Maine and fly in from Canada and from New Orleans. It's funny because one of the other problems is that there are people now, especially with this uptick in everybody getting into menopause, there are now a lot of companies popping up and people doing things and putting people on stuff which literally does nothing, or I wouldn't say it's harmful, but it certainly is not doing anything to help them. And that's one of the problems also now, because there are people out there who are doing this, who are not well trained, who don't have a clue, and who are treating people and are giving bioidentical hormones a bad name.
Yes, it's really important to know your provider and make sure you're getting great care. Do the research for sure, and go to somebody that's established in this and have been doing this for a while. Your point is very well taken, Dr. Harris.
29 years.
Yes, that's wonderful. It's been such a joy having you on the podcast. I'm so thankful that you came on to share your expertise and that you're so passionate about women and making sure that they get optimal care in that last third to half of years of their life. Thank you so much for all you do.
Thanks for having me.
All right, listeners, thanks for tuning in today, and I will see you next week. Thanks for listening to the Health Habits and Epic Living podcast. If you're ready to take the next step to improve your health, wellness, and lifestyle goals, head over to www.epicu.com and sign up for my weekly newsletter. Again, that's EPICYOU.com. Please note that the information in this podcast is for educational purposes only and does not constitute medical advice.